Is
All
it
right.
morning or afternoon?
Yeah, coffee talk, coffee afternoon talk,
Morning. It's morning, we'll say.
morning. All right. Well, welcome to our webcast here, where we've gathered the risk engineering group of JKJ to talk about as companies are starting to gear up and get back to operations, all of the relevant type topics and information and things that they need to be thinking about as employees are getting ready to go back to the workplace. So whether that's an office, manufacturing plant, home healthcare facility, whatever it may be. So we had a discussion recently with a couple different clients and thought we'd roundtable the ideas and get rolling and be able to kind of disseminate the information to a broad group. So this information isn't meant to be operationally specific or customers or client specific, but is meant to be general type information. And really the best people to ask, would certainly be this group and all the different resources they have available. But let's dig into some of the content and topics that we wanted to talk about here. So, with everybody getting back, there's a lot to consider from a physical changes standpoint that clients are going to want to start to consider. So Mike, first and foremost, what should be going through the minds of these companies as they're getting rolling again?
So as companies come back to work, I believe the social distancing guidelines are going to continue, not just out in public, but in the workforce as well. So what that includes is that could include in an office environment, spacing the desks out to maintain a positive 6-foot distance from each other. It could also involve setting up points to where you're not going to have as much congestion in specific areas like break rooms and things like that. Possibly, I know that JKJ is actually installing additional coffee machines so that you don't have a lot of people around the coffee machines at one time. Just like you see in supermarkets, I think facilities are going to have to put floor markings on the floor to try and maintain that social distancing guideline.
Right.
The other thing that we've talked about are adding additional break areas and staggering arrival and departure times of employees. So instead of having everybody come into the facility at 8 a.m., maybe you stagger at 7:30, 8 o'clock, 8:30, and then you also stagger the departure times as well. For those facilities that have a receptionist, you might want to think of setting up some type of iPad system where the visitor can sign in on the iPad, and then that information or that notification goes directly to the person they're there to see, and then they can come and escort them into the building. One of the other things we thought about were buildings with elevators. Maximizing the use of the elevator to 2 people at a time. And other people, for good exercise, might be able to take the stairs as well.
So, and with all of these are atypical for what kind of our cultural behaviors are, especially in the U.S. What are you envisioning as how do you get this information out so everybody's prepared to act in a certain kind of way, prepared to avoid certain type of behaviors that were typical in the past? And anything that you've seen or thought about?
Well, I think at this point we're being inundated with so much information from the CDC, from OSHA, from the National Institutes of Health, and it's just being able to gather that information and trying to find a system that works best for you, the client, or even for JKJ, based on the workforce that we have. What works in healthcare might not work in industry, in a manufacturing setting. So the parameters are going to be different in each and every one. So I think it's gathering all of that information, putting policies and procedures in place, and finding out what works for you.
And do you see this as a steer stepping process, or is this 0 to 100? So
Nope.
we're all at home and now we're all back, and this is how we're
Yeah,
going to operate.
I I think companies are going to have to bring employees back at a slow pace. And then as they start to bring employees back, they're going to find out what's working and what's not working. And then they're going to be able to adapt to the circumstances. It may get to the point where, you've got employees, a certain set of employees working in the office Monday, Wednesday, and Friday, and then working, telecommuting Tuesday and Thursday. Cullen brought up a great point the other day. You may have to go to 7 days a week, where some employees work Monday, Wednesday, Friday, Saturday, Sunday type of thing. And then alternate on a weekly basis, just to limit the amount of people that you have in the workforce or in the working environment.
Right. So John, I know, with on a personal time, people are being much more conscientious of sanitizing their hands, washing their hands, but in reality, most people have their phone in their hands when they're in a supermarket or anything like that anyway. Is there things that are, whether it's commonly touched places or whatever, that employers need to be conscientious of as well?
Yeah, absolutely. The risk control group is always looking to engineer out exposures in the workplace. And this is a good time to be able to take some of those measures. So, just within the JKJ office, we're looking to go hands-free with the faucets, hands-free with the soap dispensers. We're going as far as ordering a voice-activated copier. Propping doors open that are not fire doors is another measure that prevents people from having to touch. So those are some of the things that we would like to do in-house, but we'd also like to practice, with our clients as well, and let them know that anywhere that we can go hands-free is going to minimize the exposure.
And are devices like that readily available? Are they tough to come by? Have you done any research behind that?
I personally haven't, but found out that even the faucets are relatively inexpensive.
They are, yeah.
So, yeah, and I noticed, I did a little bit of research with the copy machines, and I saw that those are more common than they were just a couple months ago. So they're out there. I think they're just going to be more prevalent as we move forward.
Yeah, right. Great. Well, thanks, Sean. Cullen, how about from like a facility standpoint? Anything that you've come across that different companies are going to have to be aware of?
I think one of the biggest things for folks is to kind of consider air quality indoors. You're going to have some employees who are really concerned with that recirculating air, making sure that we're getting enough fresh air into a building. It's going to be tough to change an HVAC system in the short term. So one thing that you can really do is just check filters. Make sure you've got filters with a certain rating. It's called a MERV rating. And you need a MERV rating of 13 to help effectively, 13 or higher, to help effectively filter, particles, including particles the sizes of, viruses and bacteria. So taking a look at that, changing those filters, we're not quite sure exactly how long this is going to go on, but, for the foreseeable next few months. So make sure you get a stock of those filters, and monthly changing those out is a really good idea. Some other things you can do, locally, you could get air filtration systems like a HEPA filter units to place around the facility inside, where you've got, maybe a little bit more concentration of people in their cubicles and stuff. So there's a few things around air quality that you can do for sure to help make people more comfortable.
And allergens, I guess, aside, but it's something as simple as opening windows. Does that improve air quality as far as like the virus is concerned?
It does. One of the recommendations is to increase the amount of air intake from the outside. So yeah, for sure, you'd want to try to get as much air into the building as you possibly can. If you have a system where you can adjust intake, one of the recommendations is to maximize it, as much as you possibly can to get that fresh air in. You have to look at things like balancing of a system and how effective it is, and you could put a strain on your system actually if you kind of mess with it a little bit too much. But there are options out there. The filters, I think, are probably the best thing to just use the system regularly to keep it in balance. So that's probably your best bet.
Gotcha. So obviously the physical nature of this is something that people might be thinking of first and foremost, but really just as important is how people are acting and expectations of employees, employers as they're getting back. A lot of families obviously balancing with kids being at home when they're normally at school. So from that standpoint, and I think a lot of that burden probably falls on the HR function. What should employers be thinking about here?
Well, I'm certainly not an HR expert, right? But
Yeah,
you
no,
have to
right.
look at the screening that's taking place right now for any businesses that are open. That's going to continue, so as folks continue to open up business and you get more and more people in, you got to keep that screening in place. So taking temperatures is a really good idea. There are guidelines from CDC, the EEOC, ADA, what you can, what you cannot do in terms of taking temperatures for folks. But you want to continue that in the least invasive way as possible, right? It's really important to give people a heads up, give them notice that you're going to do that. So you want to have a policy around that, have it written, disclose that, before folks start showing up. So start thinking about that right now. You can continue to ask about symptoms. That's perfectly fine. That's okay. But again, you have to be careful, in compliance with ADA and EEOC guidelines. So you want to research that stuff. All of this information you have to think about is, it's medical information too. So you have to be really careful as an employer to make sure that you are processing that stuff and keeping it private, right?
Right.
Some of the things, you want to basically just have a conversation with folks. Communication is going to be important. Make sure people are comfortable. Get feedback whenever you implement these changes. I think it's really important that you should have an overall policy documenting exactly what it is you're going to do for your workplace. You want to communicate that. So you've got to get it out there and train folks on it, and then just monitor the feedback from people. As you start to open up, it's probably going to be in phases, like Mike said. It's not going to be all at once, but you have to think about, well, we've been out of work. We've been away for 6 weeks now, I think. So you have to almost onboard folks again.
Right.
There are going to be some things around like benefits and healthcare that are going to have to get worked out. So this is a time to really start thinking about all of those things as we start to hopefully get opened up here in the next couple of weeks.
Yeah, that's good stuff, Colin. And so, personal hygiene is always kind of something that's in play with this too. And not that people have poor personal hygiene, but I think just habits naturally are not conducive to viruses spreading quickly. So whether it's how often we eat with our hands, sandwiches, whatever, how often shaking hands to start a meeting, even things like that. So how aware, how do we increase awareness on this? What should be the policies on it? Mike, you have any thoughts on this?
So, personal hygiene is always first and foremost. A lot of times, when people touch something, they don't think about washing their hands. They go on with their daily business. They, touch their face, they, rub their nose and do whatever they need to do. Well, statistics and studies have found that that's how the virus actually enters our body, is through the, through the mouth and nose and eyes and things like that. So, hand washing is going to be, extremely important once people start to get back into the workforce. So, CDC has guidelines on hand washing for, 20 seconds with soap and warm water. Companies may need to install hand sanitizing stations somewhere in the work environment, especially if it's a manufacturing environment. They've actually got portable hand stations that they could install somewhere in the plant, so employees aren't constantly having to go to the washroom to wash their hands. You're going to need to increase the use of hand sanitizers at the desks, in break rooms, in meeting rooms. You're going to need to increase the use of the hand wipes or the sanitary wipes that people use. I think you're going to see a lot of people wiping down a lot of things a lot more frequently now. long after this virus disappears and we go back with our daily living. You know, one thing that people don't think about is, you know, handshaking. Every time we meet a new person or, you know, greet a friend, we're always shaking their hands. And, you know, you may not see that happen in the foreseeable future.
And I didn't even realize I was doing it as you were talking, but people are, you know, Cullen's doing it right now. We're always touching our faces, aren't we?
Yeah.
You know, whether it's a habit or, you know, whatever it may be, whether it's this or, and getting used to not doing that, it's tough to break. And in reality, everybody does it.
Yeah, that's a great point. Like, you're gonna have to. It's gonna be odd, but as the employer, you know, you've got to kind of provide some feedback on that kind of stuff, which may be some strange conversations, you know, with people who, you know, have a tendency to do that stuff a little bit more. But I think it's really important that you do that to protect them. And Mike made another good point on the meeting spaces and gathering spaces. You know, we're doing all this virtually today, right? Even when you're all back together, you're probably going to have to do some of this stuff. You know, you're in the office, but, you know, we should really limit those gatherings in the conference rooms and stuff like that. So you may continue to do these things virtually, you know, hiring people, interviewing people. We have, you know, the ability to do that stuff remotely. So employers are probably going to have to shift to doing that for quite a while.
Sorry, I was on mute there. But getting back, what are the guidelines that employers and companies should be thinking about? You know, what's the right amount of, you know, should people be personally responsible for cleaning each of their workstations when it's done? What's the good practice with this, and what should employers be thinking about? John, you got any thoughts on that?
Sure. There's onus on the employer and there's onus on the employee. And we already talked about, I think Cullen was talking about making sure that you educate employees not to touch their face as much as they used to. They're going to have to be educated to be cleaning their individual station or individual area on a more frequent basis. So that's onus on the employee from that standpoint. Then on the employer, the CDC just released 2 days ago, I believe it was, guidelines for various different industries for cleaning and disinfecting. So those guidelines are going to have to be followed upon returning to work. And then we talked earlier about the hands-free items. Well, not everything's going to be hands-free. So as an employer and employee, we're going to have to make sure that we're cleaning off those commonly touched areas that just can't be hands-free. Doorknobs, phones, and other areas where we're commonly touching. Yeah, so those are some of the things that have to be thought of.
I know the CDC. I've heard the CDC a lot, John. So that's a good resource, I guess. You know, what other organizations are putting out good content on this, and it could be a good resource for companies?
Well, the CDC is definitely the number one resource. OSHA has provided some guidance materials from a healthcare perspective. Leading Age has chimed in with a variety of resources.
So industry groups have been pretty
other
proactive.
Industry groups, correct.
Yeah. And so as far as equipment and where that fits into the equation here, what's the new norm? Is everybody going to be wearing something and required to?
Apparently, you know, according to the most recent guidelines, everybody is going to be wearing something covering their face. And, you know, the important thing to remember is, regardless of whether you're wearing an N95 respirator or just some type of face covering, is that the purpose of that is basically to protect you from any type of airborne contaminant that's out there. And it's also to keep any airborne contaminant that you may exhaust within your face mask. There's so many people apparently traveling around these days that are you know, asymptomatic carriers of this virus. There are going to be people that have this virus that never knew they had it, which is why, you know, partially that they're pushing for the antibody test these days. So regardless of what we see, the face coverings are going to be something in the near future. I just got an email today about from American Airlines that they're going to be requiring all passengers to wear some type of face covering when they get on the airplane. So I think it's going to be the norm moving forward, at least for the foreseeable future at this point.
And are employers going to be expected to provide the masks, or should employees be planning on obtaining their own? You know, I've even heard of clients altering their manufacturing process to be producing different kinds of personal protective equipment, but some masks. So it seems like they're going to be more readily available. But is there any type of, you've heard N95 a lot. It was funny in the beginning. I remember reading different sources saying it's either N95 or you might as well not be wearing a mask. So at least having something helps. But where do you go for guidelines as to what's the best and just obtaining a mask, and are the washable ones tend to be the most convenient? Do you have any thoughts on that, or really for anybody?
Well, the one thing that needs to be considered is resistance. Wearing just just an ordinary cloth face mask provides very little resistance. But if you wear an N95 all day long, you're going to notice a difference. There's going to be quite a bit of resistance with the N95. So you have somebody who's already doing a physical job, and you put an N95 on them, it's going to be a long day for them. So that does need to be considered.
Yeah, and OSHA's got requirements for people that actually wear N95 respirators because it is a filtering face piece respirator. So it does, like John said, it does provide restriction to your breathing. So there's specific protocol that employers have to follow when they're issuing the N95s, as far as the medical questionnaire, as far as the fit testing and things like that. Now, granted, during this crisis, OSHA's relaxed part of that requirement, but I foresee them going back to that requirement rather quickly when this thing starts to come to an end. So that's where employers, instead of trying to get a hold of, for one thing, because quantities are limited, and then issuing or putting in a respiratory protection program, are probably going to be more apt to go with the face covering versus the filtering face piece respirator.
And I think states are going to make their own specifications for employers when they start to open up. So everybody just really paying attention to the state requirements for face coverings, who has to have them, and so forth. We know that we've generally seen cotton 2-ply is what's recommended for the general stuff. So I would just continue to monitor CDC and state requirements as businesses get back open.
Yeah, that's a good point, Cullen. So with things getting back moving, inherent of all businesses are people getting together and moving places, right? So I've heard a lot of travel, essential and non-essential, really being removed, but obviously the first thing to kind of trickle back in is essential. But whether that's going places or having people to the facility of companies, what should be the considerations here?
Well, visitors, deliveries, you're probably going to want to really limit that stuff for a while. If you could get deliveries dropped off outside of the business, that would probably be the best thing to do. I could probably simply just put some signs out for, the UPS and the FedEx guys to just drop off, and then, your folks can go out and get it. If you're in a situation where that's not possible and they do have to come into your business, I would, very much limit where they're going to go, limit who's going to interact with them. The person interacting, getting packages, you're probably going to want to have, PPE, disposable gloves, and a face covering. And, you really have to think about sanitizing what's coming in. I've seen a lot of, we've probably all gotten tons of deliveries to our houses during this time. I'm seeing some delivery guys. I had one today. He didn't have anything on. He had no gloves. He had no mask on. So, it concerns me about who's doing what. So you really have to think about probably sanitizing things as they come in, cleaning them. I would try to limit the packaging that's coming in if you can, right? Open things up, take out the contents, take that, leave the packaging, and get rid of that. You know, if it's something that you think probably has been packed for a while, it's got good packaging, and it looks like it's not, you know, custom packed and delivered for you, you're probably, you know, it's probably fine. But you really have to think about, can we sanitize stuff coming in? So you're gonna have to really just look at what you're receiving.
Yeah. So, and I think there was an important thing. Maybe we should have said it at the beginning too. With states lifting sanctions, this is really what kind of sparked us the idea of all of ours to get on this call, and as employers are starting to think of getting back to work. But today is Friday, May 1st. Everything that we talked about is rapidly changing, and there's new recommendations coming out, and ways to handle this are evolving. Like even just the knowledge around the virus is developing so quickly that all advice should be reviewed internally and with the professionals that you work with. But you guys specifically within our organization, JKJ, are a great asset to our clients and being part of their team in the plan of getting back to work. So with that, I would like to reinforce the fact that, you know, this is certainly for informational purposes, and it is a very high level view. It isn't a full return to work plan. So there's a lot more digging to be done for any organization as they look to getting back to work. But wanted to thank you, gentlemen. Appreciate it.